Hi, Blood Talk fans. I hope you are doing well and ready to continue on our journeys in urine culture. We talk about specimen collection, transportations, and ID using traditional method already. Today we'll be talking about identification using microbiology instruments. This is more of how we ID organisms in clinical laboratory nowadays. Without further ado, let's get into it. I will talk about the two instruments that my hospital used, which are Vitek 2 and Vitek MS, or also known as MALTI-TOF. Let's start with Vitek 2. Vitek 2 is used to identify microorganisms isolated from patient specimens and provide guidance for antimicrobial therapy based on minimum inhibition concentrations, because beside ID, these instruments can also perform sensitivity. Vitek 2 is a fully automatic system that uses advanced colorimetry technology to identify routine or common organisms isolated from patients. Colorimetry is a technique that is used to determine the concentrations of colored compound in solution. The gram-negative identification card will identify most clinically significant gram-negative bacilli based on the reactions in 47 microbial. The gram-positive identification card will identify most clinically significant gram-positive cocci based on the reactions in 43 biochemical tests. The results for gram-positive and gram-negative could be ready in 8 to 10 hours or less. However, the results for yeast would be ready in about 18 hours based on 46 biochemical tests in yeast identification card. So each card comes with this little well in it, and in those well have pre-embedded agents that would react or perform the biochemical test automatically. The Vitek 2 sensitivity test method is based on the standard 0 to 4 dilutions to determine a minimal inhibitory concentrations. An antimicrobial susceptibility test card is needed to perform susceptibility tests. Each AST card contains 64 microwell. Each of the 63 well contained pre-measured amounts of specific antibiotics combined with culture media. The other well is a growth control well. The Vitek 2 used the software to generate susceptibility test results much more rapidly than the traditional way. Next is Vitek MS, or also known as MALTI-TOF. Vitek MS. The MS stands for mass spectrometry, that uses the MALTI-TOF technology to identify organisms. That's why this instrument is sometimes referred to as MALTI-TOF. Mass spectrometry is an analytical technique for generating a spectrum as a raw result to identify microorganisms. There are different types of mass spec, but for this instrument, it uses MALTI-TOF technology. MALTI-TOF technology involves mixing a microorganism culture with a metric, which absorbs energy from the Vitek MS lasers and transfers it into the microorganisms to enable ionization. How does this work without samples? Protein inside the organisms become positively charged when mixed with the metric. The metric absorbs the lasers and vaporizes along with the microorganisms' ionizations. Electric fields then guide the ion into the vacuum tube, which separate them according to mass and the time of light. The smaller molecular travel faster than the fast molecular. The results are displayed as series of lines or spectrums. The instruments then compare the spectrums with the database to give us an idea on our organisms. Here is a table compare the main features, similar and differences for Vitek 2 and MALTI-TOF. That's all I have for today. Did I miss anything? If you have any questions, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!